Good morning, Mr. Jones. My name is Kenisha and I'll be your nurse for today. And I will be performing some wound care on you. How are you feeling? Okay, any pain or discomfort? Okay, can you confirm your full name for me? Okay, how about your date of birth? Okay, thank you. So I will be putting on my gloves right now to assess the wound. Do you need to use the washroom before we start? No? Okay. So I'm putting on my gloves now to assess the wound. Okay, so I'm going to lift up your gown and then I'll be checking. So first of all, I'm going to remove the dressing that is here first and dispose of this in the garbage. Now, looking at the wound, I'm going to use the reader assessment to look at the wound. There is a little bit of redness. There is no edema, no drainage, no ecchymosis, and approximation, this wound is well approximated. The edges have come together by the sutures that is here. So now I'm going to measure the length and width because the wound is well approximated.
Perfect, so now it's clean. I'm just going to throw it in the garbage. Perfect, so now that it's done, I'm just going to remove everything. Fully covered. This is our garbage.
So I will not be able to test for undermining or tunneling because the wound is well approximated. So I'm going to check for the length of the wound and I will use my ruler to confirm. So the length of the wound is 13 centimeters and the width of the wound
Get rid of our PPE while we're still inside the room. So we're still inside the room.
is 2 centimeters.
So this is the proper dimension. I'm sorry, the proper width.
Now I'm going to remove my gloves and
So first, I'm
perform hand hygiene.
to remove my gloves. So making sure that it's glove.
I'm going to mention, I forgot to mention also that the patient's bed is at a walkable height, so there is no need to adjust the patient's bed for me. So I'm going to perform my hand hygiene and I'm setting up now to perform my sterile feed.
Okay, and then next, I'm going to remove my gown. So I'm going to go to the next first. Bring this in. Making sure I'm not touching the outside dirty part.
Hi, my name is Kat. I'll be your student nurse today.
So that's what
Cover back the patient and perform hand hygiene.
here. I'm not going to touch it on the dirty part, so I'm going to remove it by putting a finger inside the gown. Pulling it, and then now using this part, pull it, and then I'm going to roll it. Alright.
I'm going to Lysol the surface area.
Throw it away. This one, and then I'm going to do some highlight. And now that I've cleaned off, now I can edit the work. Okay, thank you.
Okay, and I'm going to add underneath. Okay, the patient is taken from the table.
Alright.
Pour water.
Okay. So I've cleaned my surface area. I'm going to perform hand hygiene one more time before I start opening up my sterile kit.
And now opening the
So you take the kit out and you can throw this in the garbage. And you can open the gloves as well. And throw this in the garbage. I'm going to also now perform hand hygiene again, just to maintain sterility so that there's no infections, no bacteria, nothing getting onto my surface.
Okay, so So I'm going to be doing my skill today. So I'm doing perinatal care. So the first thing I'm going to do is...
So for opening the sterile kit,
So
I'm going to first
still outside the room. While I'm still outside the room,
hold the tip here, the flap here, and move it away from me.
I'm done hand hygiene. Okay, because we're in droplet contact precautions, I'm going to make sure that I put the PPE on before I enter the patient's room. So that's
Ensuring to maintain the sterile feel.
putting on PPE. The first thing I'm going to do is I'm going to put the gown on.
And ensuring also that my hand does not go below my waist. So there is a 2.5 centimeter boundary that you do not want to cross. And I'm going to remove my forceps here. And
Okay, so I do the neck first, then I'm going to do the back. And then when
I'm turning this to make a square using the forceps. Also maintaining the boundaries of the 2.5 centimeter sterile field. So now I'm going to remove the contents of the tray onto the blue pad, maintaining the sterile field, not going over the 2.5 boundary.
and then I'm going to be putting on my gloves.
Now I'm going to lay this forceps down, ensuring that the tip does not go beyond the non-sterile field. Now I'm going to add the solution to the tray, making sure that the label is in the palm. With my dominant hand, I'm going to open the solution and add it to the container. Now I have some gauze to open. I have some gauze to open. 2x2 gauze. I'm going to perform some hand hygiene again. And open the 2x2 gauze, ensuring to maintain the sterile field still. Okay. Now I'm going to apply, I'm going to put on my gloves. I'm going to perform hand hygiene, and I'm going to open the gloves. Oh. So with my dominant hand, I'm going to start putting on the right gloves because I'm right-handed. So I'm going to grab the inside of the gloves. And I'm going to pull this gloves down, ensuring not to touch the outside, maintaining sterility. I'm going to use my left hand now, put on the left gloves. So I grab the inside and
okay, now what we have to do is we have to do the catheter. So I have my catheter solution. I'm going to put it. Okay, with my non-dominant hand, I'm going to hold the catheter. Okay, and I'm going to clean from the entrance. This is Laura's position. I'm going to take this first catheter. I'm going to dispose of everything.
ensuring to maintain principles of sterility.
I'm not cleaning for the patient. My hands
As well as remove as well
on a count of 1.
And there you have it. This is performing wound care and opening up a sterile field. So now I'm going to remove the gloves and perform hand hygiene.
Okay. So first, I'm going to remove my gloves.
I'm making
So
sure
it's going to be
my
glove, and then skin to skin.